The recovery from somnoplasty of the nose is approximately 4 or 5 days with very little downtime. Patients after the treatment in the nose feel like they're stuffy, kind of like they have a cold, but that's about it. They're not sick like they have a cold, but they just feel stuffy in the nose. After about a week, their breathing is back to normal. We usually see patients 2 or 3 days, and then again 7 days after the somnoplasty of the nose to clean up their noses. And then the breathing continues to improve for months afterwards. Somnoplasty of the soft palate is a little bit longer of a recovery in that the treatment makes one feel like they have a bit of a hot pizza burn on the roof of their mouth every time they swallow. And again, that lasts for about a week. Oftentimes, in combination with somnoplasty, we will remove the uvula, or the little punching bag that's attached to the back of the soft palate, at the same time. And when we do remove the uvula, there is a bit of raw tissue area there that takes about 10 to 14 days to heal. But for the most part, if we're just doing somnoplasty of the palate, it takes about a week to 10 days for patients to feel back to normal.